Hi, my name is John Flett. I'm a pediatrician who spends my time assisting families and kids and teachers. Children have challenges both at school and at home. One of the things I'd like to talk to you about is ADHD and anxiety. Now, it's common for children with ADHD to also struggle with anxiety, and this is not necessarily always understood. You know, there are two aspects to anxiety and ADHD. Number one, ADHD can go together with anxiety. 30 to 50% of children who have ADHD can also have a primary problem with anxiety. So if there's a family history and as parents, if you look deep and you're honest, you might also recognize that there's also ADHD and anxiety in the family. Now, untreated, unmanaged ADHD can lead to anxiety. And that's often the presentation in adults that do not get treatment. Chronic, unexplained underachievement, growing up not feeling good enough. Other kids in the class when you were at school, they getting A's and B's and you getting C's and D's. And you know you're just as bright and as smart as they are. And yet, over time, you try your best, and yet you can't unlock who you are. And these are adults that grow up, and as they progress, they kind of take on more, particularly women who kind of take on more family responsibilities, children, pregnancies, and then it's like juggling. You know, most people can juggle two. When you juggle three, I'll have a go. But how about four? You start to drop things. And as more you take on, and the anxiety is this feeling of being scattered, overwhelmed. So there can be secondary anxiety with ADHD. And that can happen in children as well. But how about primary anxiety? That genetic, inherited type of anxiety that often also is in parents. And I see this every day in my practice. Kids who are overwhelmed, they're overthinkers, they're perfectionists, often got parents. Sometimes they put a little bit too much pressure. And also, unfortunately, some schools and teachers put too much pressure. And some children don't process this very well. And they feel anxious, worried. Anxiety is kind of an overactive alarm system in your brain that's triggering threats and perceived threats that are not real threats. You can't stop thinking. You overthink. When is it going to happen? When am I going to get picked up? When is that deadline? I can't sleep. I wake up in the morning. I'm worried about what's going to happen, which is something totally separate to ADHD. And yet, the two symptoms can look very similar. So how can you distinguish ADHD from a child who's fidgeting, looking disinterested, not kind of paying attention, mind wandering, impulsive, and being busy? Because those children can also fidget with their fingers, pick their fingers, look around, and children who are anxious can have very similar symptoms. So we need to distinguish, and it's often the reason, the cause of the problem. Often there's a family history, children with anxiety, particularly when they are kind of over-expected at school, deadlines. They can also have stomach aches, headaches, psychosomatic symptoms, don't want to stand up in front of the class and do individual talks and speeches, individual sports at athletics. And swimming and other sports don't like to do those things. Social anxiety, don't want to go on school camps, don't want to spend time with lots of people. So these are things I'd like you to think about, because it's no good us just treating ADHD and leaving all these other important things untreated. Children can really suffer. And you know, both are so treatable. ADHD, medication is highly effective. Anxiety, there are other options. What also kind of stuns me is that parents have no problem being able to put their child on a Schedule 6 medication for ADHD, and yet they have such resistance to treating anxiety. Often because when anxiety management, which remember is not just medicine, it's cognitive behavior therapy, dialectic therapy, therapists, play therapists to help. and also removing the cause of the anxiety, breaking things down and managing the ADHD. But often when a medication for anxiety is suggested for a child, parents often put their hands up because often it's kind of something that is a bit close to home. Emotional difficulties we perceive as should not need treatment. You must just get on with it. So I'd like to change that narrative and think very carefully, because your child could really be suffering. And sometimes parents are often on the same medications. And to think that your child has to have the same medication that you on, or a parent's on, sometimes doesn't sit right with parents. So get expert help, get the help, somebody who can look at things holistically. And remember, it's not just medication. Getting your child to sleep right. If you don't sleep right, you're going to wake up anxious, worried. Getting enough exercise, socializing, support. And often from a parent's point of view is getting help for yourself. Because when you are regulated, you're in charge of yourself, you are able to manage your child better. So these things that ring true with you, that's something that I deal with for a living, and we can really help you.